Type 1 and Type 2 thinking. Type 1 intuitive, heuristic, pattern recognition. Type 2 analytical, systematic. Type 1 automatic, subconscious. Type 2 deliberate, conscious. Type 1 fast, effortless. Type 2 slow, effortful. Type 1 low variable reliability. Type 2 high consistent reliability. Type 1 vulnerable to error. Type 2 less prone to error. Type 1 highly affected by context. Type 2 less affected by context. Type 1 high emotional involvement. Type 2 low emotional involvement. Type 1 low scientific rigor. Type 2 high scientific rigor. This point you can stop to think about your thinking rational override in figure 1.6. What is the evidence for this diagnosis? What else could it be? On the other hand, imagine being asked to assess a patient who has been admitted with syncope. There are several different causes of syncope, and a systematic approach is required to reach a diagnosis. Type 2, type 2 thinking. However, you recently heard about a case of syncope due to a painless leaking abdominal aortic aneurysm. At the end of your assessment, following evidence based guidelines, it is clear the patient can be discharged. Despite this, you decide to observe the patient overnight just in case. Irrational override in figure 1.6. In this example, your intuition is actually availability bias when things are at the forefront of your mind, which has significantly distorted your estimate of probability. Common cognitive biases in medicine. Figure 1.7 illustrates the common cognitive biases prevalent in medical practice. Biases often work together. For example, in overconfidence bias, the tendency to believe we know more than we actually do. Too much faith is placed in opinion instead of gathered evidence. This bias can be augmented by the availability bias, and finally by commission bias, the tendency towards action rather than inaction, sometimes with disastrous results. The mark of a well calibrated thinker is the ability to recognize what mode of thinking is being employed and to anticipate and recognize situations in which cognitive biases and errors are more likely to occur. Thinking about thinking. Research has highlighted the importance of being aware and being able to think about one's own thinking, also known as metacognition. Several studies have demonstrated that engaging in reflection during diagnostic decision making improves performance. Prakash et al. See further information. This can be as simple as asking, what is the evidence for this diagnosis? What else could it be? If reflection is most effective when the case is more complex relative to the clinician. Some people have a natural tendency to look for evidence, weigh things up, be aware of context, not take things at face value, and think about their own thinking. Others can learn to do so. Psychologists consider this reflective mind a subset of analytical type 2 thinking. The tendency to engage in reflection during decision making is independent of knowledge and cognitive ability and accounts for the greatest variation in individual performance on many reasoning tasks. With increasing knowledge and experience, intuitive type on thinking is used more. It is fast and highly accurate and commonly used by experts. Novices cannot do this because they have not yet built a database of patterns in their long term memory known as illness scripts. Reflection interrupts type 1 processing even briefly to simulate alternatives. So, as you can see, good decision making relies on knowledge and experience but also the ability to stop and think when needed. However, this requires cognitive effort type 2 thinking, which may be impaired by things like fatigue, interruptions, and cognitive overload. Human factors. Human factors is the science of the limitations of human performance and how technology, the work environment, and team communication can adapt for this to reduce diagnostic and other types of error. Analysis of serious adverse events in clinical practice shows that human factors and poor team communication play a significant role when things go wrong. Research shows that many errors are beyond an individual's conscious control and are precipitated by many factors. The discipline of human factors seeks to understand interactions between people and tasks or technology, people and their work environment, people in a team. Experience, context, ambient conditions, type 1 processes. Education, training, logical competence, type 2 processes. Cognitive biases more likely, override, irrational override, working diagnosis. Clinical presentation, recognize type 1 processes, if not recognize type 2 processes. Figure 1.6, the interplay between type 1 and type 2 thinking in the diagnostic process.